Okay, so last time we were together, we prepared an odd assortment of upper anterior teeth for porcelain veneers. The reason we chose teeth numbers 9, 10, and 11 was more for what it could teach you by doing that kind of a combination of teeth. And as we mentioned before, usually you're doing maybe 2 centrals or a single central or a lateral or 4 incisors, 6 anterior teeth, 10 teeth. It's usually a little different combination than this. We'll assume at this point that you've been able to make a nice impression, whether it's digital or PVS or whatever you're using. Those are probably the 2 most common. After you've made your impression, you need to make temporaries for these veneers, and veneer temporaries can be very challenging. You can make temporaries for your veneers traditionally, just like you would for any temporary, any indirect restoration, where you create a matrix and then put the material into the matrix, insert the matrix into the mouth, and then make that temporary indirectly where it's coming off the tooth, you're adjusting it, it's going back onto the tooth. I'm going to teach you a technique that while you can't use it in every situation, it does have some application, and it will save you a lot of time if you're able to do it this way. The technique involves leaving the veneer temporaries on the teeth and doing any adjusting on intraorally on the teeth so that the temporaries never come off. You have to be very careful if you use this technique, because you're not going to be able to finish your interproximal margins as well as you normally would like to for an indirect restoration. And the last thing you want is inflamed soft tissue when it comes time to bond your veneers in place. So what I would suggest is, when you have a case like this coming along, calling up your laboratory and making an appointment, letting them know that you have a case that you'd like fast-tracked. And usually your laboratory, most labs can do this in about a week. That's one part of kind of the puzzle with this, is make sure you coordinate with your laboratory ahead of time so that these temporaries are not left in the mouth for a long period of time, because they will inflame the gingival tissues if you do. The other thing that you need to do is prescribe a chlorhexidine rinse for your patient for that week that the temporaries will be in place. And as long as it's no longer than a week, you're usually okay. So that's the technique we're going to show you. Again, it has a limited application. The advantage is you don't have to take off those very thin veneer temporaries and it's like trying to adjust a fingernail and then putting it back and bonding it into place. The way we'll show you how to do this on typodont teeth is a little bit different. You need to use petrolatum to keep the temporaries from sticking to the typodont teeth. In the mouth, no lubricant is used at all, nor is any bonding agent. So just the bis-acryl material injected onto the tooth surfaces. You need to get excess saliva off, but I wouldn't recommend, just dry them to the point of being dry, and then make your temporaries. And they, in most cases, will bond well enough, because this material, as you know, when it polymerizes, it shrinks a little bit, and it's going to pull itself down on to the tooth structure, and in most cases will stay on very, very well for a short period of time. So that's the technique. Again, we'll use petrolatum on typodont teeth just so that we don't lock these temporaries in place. So the first thing that you would do then is take some of the petrolatum, and you don't want to put it on gobby. You just want it to cover, and you do want to get it on obviously the teeth and the surrounding, the prepared teeth, the surrounding tooth structure, unprepared, and the gingival tissues as well. So I'm putting it in place, and then I'm going to spread it out so I don't have lumps of this material or gobs of this material left in place. If you do, the Bis-acryl doesn't have the viscosity to displace the Vaseline or the petrolatum, and you'll have voids. So make sure that you thin it out after you've applied it, but do thoroughly apply it, or you will have places where it sticks and you won't get it off. You'll have a hard time separating it from the typodont with this exercise. So be thorough, but not too much in terms of amount. So I'm going about 2 teeth in either direction. And I'm taking it up onto the gingival tissues facially and palatally. Okay, we have a matrix that we created preoperatively for this. That matrix normally would be made, you could make it right on the tooth structure if you're not changing shapes of teeth. If you're changing the morphology of the tooth structure with your veneers, then this matrix would probably be made off of a wax-up on models and then brought to the mouth. So either way will work. Because we're not changing the final shape of the teeth, there's no reason that we can't make this directly intraorally like we're doing here. So that's spread out pretty well. We'll leave that alone. The next step is to take this matrix that we've made, and we're going to place 3 holes with a number 8 round burr in the facial aspect of the matrix. And the first hole will be right on the straight facial of tooth number 10, which is the middle tooth of these 3. And then the second 2 holes will be at the distal buccal line angle of tooth number 11 and at the mesial buccal line angle of tooth number 9. And you'll see why those holes are there in a minute, but the first thing to do is to place those, and so we'll get our slow speed handpiece out here. Approach this, so here's tooth number 10 right there, and I want to try to get this close to the mid-facial. I'll approach it from the outside in, just like that. And then I'm going to do the same thing at the distal buccal. I'm going to angle this one because this is an exit point. This is where the material is going to exit. So I'm going to kind of come off at an angle like this so that imagine in your mind's eye the flow of fluid and fluid dynamics. You want to create a path of least resistance for the material to flow so that you don't end up with any voids in your temporary. So I'm going to angle this one. And then I'll do the same thing with the one on tooth number 9, where we'll kind of angle it, but try to enter at about the line angle there. Like that. Once those are made, it's really important, I can't emphasize this enough, to get rid of the debris. If you have any debris left in there, you will have the debris in your temporary. And you don't want little blue flakes of debris in your temporary. Your patients won't like that. So let me make sure to get all the little, this is just, I can't emphasize this enough. It's almost worth changing gloves at this point. I'll try to get all of that debris off, and it seems to be able to be blown off quite easily with my compressed air. So just with that compressed air, really create a clean situation. Okay, so I'm just picking any flecks off, little excess piece here and there to make sure that there's no debris at all left with our temporary matrix. We have the petrolatum that's been applied to the prepared teeth. And the next step now is to simply put this in place. So we're going to set our matrix, and of course this is a little different technique, isn't it, that you learned with making temporaries for indirect restorations, where you inject the material into the matrix and then insert it into the mouth. By putting the matrix in place and then injecting the bis-acryl in, you get a much better anatomical reproduction of what you're looking for, and so there's a lot less excess material to trim away, and that's one of the things that allows us to make the temporaries in this fashion. So the next step is to get your bis-acryl gun. We're using Integrity here today, and always with any of these bis-acryls, make sure that you bleed the two barrels so that you get an equal mix. So I'm going to just express a little bit of that material until we get some of both materials. And there we're starting to get both materials. So once you've expressed enough to you're getting some out of both barrels, then we'll place our mixing tip in place like this. And we're ready to go. So what I'm going to do next, I'm going to express enough that I'm getting some mixing out the auto mix tip. I'll drop a little off, and then I'm going to inject right through this center hole until we get material expressing out both of our exit holes. So let me express a little bit here just to get it started so we don't introduce any air pockets or air bubbles in there, and then we'll simply introduce that tip and express until we see it come out both. And then as you back it off, don't keep injecting like that. Then it's important at this point to wipe the excess off. That will help you with the cleanup. So as you are well aware, these bis-acryl materials are a dual cure composite resin material. They're acrylic composite, kind of a bis-GMA acrylic combination, and they will set chemically on their own, which we've allowed this to do. We can also speed that setup up a little bit with light, and light's not going to get down through these sprues into the temporaries, but it doesn't hurt to cure right at the entrance and exit points a little bit with the light, just to make sure that you're dealing with a material that has that's set completely. So just a little bit at each one of those sprues, and then it's also good with any dual cure material when you're all done to hit it with the light again, and you will enhance the polymerization just a bit. And so when we're all done, we'll use the light again to cure it as much as it will polymerize. Nothing polymerizes 100%, but we can get it up in the 80s. So if I were to try to remove this now, I'd pull my temporary off because the sprues are hooked up into the matrix. So the next step is to take an acrylic burr and just grind down into each one of those sprues, and it's a bit of a guessing game because you're estimating how thick your matrix is. You want to take most of the sprue off, so there's just a little bit sticking up into the matrix, and then the matrix can be bent, kind of opened up and pulled off of the temporaries. If I go too far, I'm going to grind into the surface of my veneer, which isn't the end of the world. I can add some flowable composite to that, and it bonds quite well to repair that. We also will use flowable composite if it's needed to make any repairs, if we have voids up inside our temporary. Now, if we have big bad voids and we need to remake it, and that does occasionally happen, then remake it. Don't try to repair too much. If you're going to remake it though, please make sure to clean your matrix really, really well again, or you'll get fragments of the blue or fragments of old set acrylic in the new temporary. So make sure you take the time to clean it out really well if you have to do a redo. So what we'll do next, I kind of have an idea in my mind how thick that matrix is because I've drilled through it, and I'm going to just drill into each one of those sprues to try to shorten them considerably before I take the matrix off. And that's about as far as I dare go. So at this point, you'll want to kind of peel back or take your matrix and get a finger under it and pull it out and away. And sometimes it helps to take an instrument and kind of put under the front edge like this and pull it up and away. From your teeth. And we did just exactly what we didn't want to have happen, but all is not lost. So what's happened is our temporary has come off into the matrix, which is fine. We can still use this as an indirect temporary. The idea is to get it to stay on the teeth, and without petrolatum, typically they do stay on the teeth. But what we'll do is try to tease this temporary out of the matrix and then replace it back onto the teeth like we would with any indirect restoration. So again, when you're not using petrolatum, usually they stay put, but if they don't, it's not the end of the world. So we'll try to bend that out of there a little bit more. Keep in mind, our material is not completely set. It's polymerized chemically, but it's not been light cured to enhance the set. Now I can ruin my matrix if I need to, and I'd like to not ruin my matrix if I can, just in case I need it. So let's see if it'll tease out. Again, these veneer temporaries are so fingernail-like, for lack of a better descriptor, that they're very, very fragile. And so you have to be careful. I think I'm going to go ahead and just peel that back side off. We're going to sacrifice our matrix and see if I can't pull these out now at this point. My sprues probably need to be trimmed just a little bit more. Let's see how these set back onto the teeth. Okay, they're reasonable. So these are ones that could easily, with a little repair work, complete them. So I'll get out. Of course, this has had petrolatum placed on the teeth, so it's less likely to stick, but this is what you would do intraorally at this point. is with some flowable composite, we can make the necessary repairs. And so what I'll do, I'll get these in place like they are. I'll do a little repair right here. Let's make sure these are seated from the lingual. And they do appear to be. Just making sure they're seated completely, and then we'll go ahead and cure them. Cure our repair work. Then at this stage, we'll just finish them down. So we'll assume that they've been bonded onto the tooth structure. You'd use just a spot of bonding agent. Flowable composite works nicely just to make sure that the margins are relatively sealed for the temporary phase. If you have temporaries that don't stay on, porcelain veneer temporaries that don't stay on very well, sometimes you can just spot etch just a little bit of the enamel right in the center of your preparation, and then allow that to be the area that bonds. You do need to remember when it comes time to bond your veneers in place that where you've spot etched, you will have composite stuck to the tooth right there. And so it's important that you scrape that off, that you get that bonded composite off of the tooth structure so that it doesn't interfere with the complete seating of your brand new porcelain veneers. So this is how you would finish down the sprue areas. I'll just use a sandpaper disc here. It's always a good idea to kind of hold them in place and just help to keep them from dislodging. But these can be finished rather quickly, just intraorally right back to the facial surface. And then I do the same where I've made my repairs with the flowable. Being very careful not to damage any other structures like unprepared teeth and or gingiva. Check the contours to make sure that you haven't left them over or under contoured. And I still need to do just a little bit of adjusting on this number 9 sprue. Check it with an Explorer to see how we're doing. Still got a little bit of an edge right there. This feels pretty good here. Got a little bit there that I could finish down better. Once you've finished with just the kind of the gross adjusting of this, you can either use a finer grit of abrasive, which is very easy to do, or you can even come back to your acrylic burr, which leaves a fairly smooth surface. And then we'll go to a Robinson bristle brush to do our final polish. So I've dropped down to a smaller size sandpaper disc to try to get this area on the distal of the canine. And then we'll go to a fine finishing grit. And then we're ready for our Robinson bristle brush finish. The other thing that you would do at this point is to check your occlusion, and it's very important that the occlusion on these temporaries does not take the load when you can avoid it. And let me describe that a little bit. With these particular veneers, if we were to have the mandible move into protrusive, in a class 1 occlusion like this, it would be very easy for the veneers to take that load rather than tooth number 8. Now, I'd rather that tooth number 8, at least for the duration of the temporaries, took the protrusive movement. So I would adjust it so that that load is not being taken by these veneers. Otherwise, the patient is very likely going to knock them off. When we go into left lateral excursion in a class 1, angled class 1 occlusion, we don't have much choice but to have canine guidance. So in left lateral excursion, that mandible is going to ride up the canine. The important thing is that you don't make that canine rise too steep or too abrupt. And if it's possible at all to share that load with the premolars in a kind of a group function, that's not a bad thing to do, at least for the duration of your temporaries. We also have to consider lateral protrusion. So when the mandible goes forward and to the left, that we're not abruptly hitting the temporaries in a way that might knock them off. The lateral incisor doesn't need to touch at any point in time. The central might touch very lightly, but hopefully most of the load is going to be taken by the unprepared tooth number 8. And then in left lateral excursion, just make sure that the canine is not too abrupt, because that's one that we can't avoid. And then the last thing is just to make sure that you counsel your patient to be very, very careful of those veneers for the next week, and make sure that they're not biting things off out there and they're not eating sticky foods that would dislodge them. So that's basically it. And then at this point, the final finish on these can be done with a Robinson bristle brush. Put a nice kind of a matte / polish finish on your temporaries. This technique tends to leave the surface, other than where you've had to finish them, fairly smooth and fairly well polished. And you'd instruct your patient how to floss properly. And because my temporaries came off, I was able to open up these interproximal embrasures a little more easily. You may not, with this technique, if your temporaries stay on the teeth, you may not get those interproximal embrasures completely opened up. And that's why we don't want these temporaries to be on for a long time, and why you would prescribe a chlorhexidine rinse for the duration of the temporaries. The terminal ends at the mesial here and at the distal of the canine they're easier to clean and to make it so that they're very easy to floss for the patient. So that's how to make the temporaries for the veneer preparations.